ml of saliva is secreted per day. The specific gravity of saliva is between 1.0022 to 1.009. The pH is less than 7 in resting gland and it becomes 8 during active secretion of saliva. The composition of saliva includes 99.5% of water and 0.5% of solids, which includes both organic and inorganic substances. Organic constituents are salivary amylase, mucus, lingual lipase, lysozymes, IgA, IgM, lactoferrin, epidermal growth factor, nerve growth factor, blood group substances, kallikrein, and other substances like urea, uric acid, creatinine, thiocyanate, and organisms like viruses, that is rabies, and bacteria. The inorganic constituents are mainly the sodium, chloride, potassium, and bicarbonate ions. The salivary gland includes three pairs, that is parotid, submandibular, and sublingual. The remaining 5% is contributed by minor glands in the oral cavity. If you see the parotid gland, the type of secretion is mainly the serous and it is watery, which forms around 20% of the total saliva which is secreted. Whereas submandibular, it's a mix a type of glands and the secretion is watery as well as thick, and it forms almost 70% of the total saliva secreted, whereas sublingual, it's a mucus type of glands and the secretions are viscous and it forms the 5% of the total saliva which has been uh, salivated or secreted. Coming to functions of saliva, the digestive function. First, digestive juice to which food is exposed. Enzymes present are lingual lipase and salivary amylase. Salivary amylase acts on cooked food. It is the first enzyme acting on carbohydrates. Starch is broken down into maltose plus maltose plus dextrin. The site of action is 1,4-alpha glycosidic linkage. Action is for short period in mouth and its action is continued in the stomach in the interior bolus of food and stops when pH is less than 4. Lingual lipase, secreted by the Ebner gland, is the first enzyme acting on lipids. Action starts at the acidic pH of the stomach. It has a lubricating function. Mucin helps in lubrication of the food. It assists mastication and swallowing. It protects oral mucosa. It aids in speech by facilitating movements of tongue and lips. It has a protective function as well. The flow of saliva washes away the pathogenic bacteria, prevents accumulation of food, and thus preventing oral caries. Thiocyanate and IgA are bactericidal. Lactoferrin is bacteriostatic. Saliva contains protein antibodies that can destroy oral bacteria, including some that cause dental caries. Kallikrein, by enzymatic action, form bradykinin and it is a potent vasodilator and it increases the salivary secretion. Buffers in saliva helps to neutralize gastric juice and protect esophageal mucosa. Saliva acts as a solvent for molecules to reach taste receptors. Hence, it helps in the taste sensation. It has excretory functions where it excretes heavy metals like Ag, penicillin, and lead, and also some drugs. Temperature regulation. The role it has importance in temperature regulation. It has a role in the taste sensation, and saliva acts as a solvent for various food stuffs. As taste is a chemical sense, the taste receptors respond only when they are dissolved. Mechanism of formation of saliva. The primary secretion of saliva. The acinar cells of salivary gland secrete the initial saliva into salivary ducts. The initial saliva is isotonic. The concentration of sodium, chloride, potassium, and bicarbonate is same as that of plasma. So it is modified in the ducts uh, when the reabsorption of sodium and chloride occurs in the ductal cells that line the tubular portions of salivary glands. Potassium and bicarbonate are secreted into the ducts. The ducts are relatively impermeable to water and saliva becomes hypotonic and alkaline. Aldosterone acts on the ductal cells to increase the reabsorption of sodium and chloride from the salivary ducts. Note that the potassium content is highest in the saliva. Regulation of salivary secretion. It is mainly controlled by the neural mechanism, and also there is a vascular control. Neural regulation consists of sympathetic and parasympathetic system, which is a component of autonomic nervous system. Neural regulation. Usual stimuli are taste, smell, tactile sensation from mouth, pharynx, and reflexes from stomach and intestine. Parasympathetic stimulation increases the water content and decreases the organic constituents, which is associated with the local release of vasoactive intestinal peptide. The food in the mouth control the secretion of saliva via the following reflexes, that is conditioned and unconditioned reflexes. Conditioned reflexes where the secretion occurs only with the previous experience. The sight, smell, or even the thought of palatable food increases the salivary secretion. Here the parasympathetic supplying the salivary glands are stimulated by impulse coming from higher centers of brain. Whereas in unconditioned reflexes, they are initiated by stimulation of the receptors in the buccal cavity. Impulses are carried through the vagus to the medullary center. Efferent fibers are secretomotor of 7th and 8th cranial nerve. The center is at superior, that is for submandibular and sublingual, and inferior salivary nucleuses, that is for especially parotid gland. Stimulation of sympathetic nerve supply causes the vasoconstriction and secretion of small amounts of saliva, which is rich in